Well, with the Ukrainian situation, I think probably sending dried foods, freeze-dried foods, is probably the most practical thing. Uh, Prevention is better than treatment always. If you can prevent the problem in the first place, you're way ahead of the game. But recognizing the realities of war, you can't always do that. So you do need to have some treatment supplies. I think an antibiotic like doxycycline, which is a broad spectrum, similar to tetracycline, but a little more broad spectrum, is a good antibiotic to have on hand. And there for diarrhea, that's a tough issue. If it's due to infection, there's a variety of antibiotics that have been used, and they all have their pros and cons. I think doxycycline is just the best all around antibiotic. You need to have alcohol, and they have they're called betadine swabs, which are to disinfect. You can use betadine swabs on skin injuries and so forth. Betadine is helpful to clean up infection areas and allow them to heal. Mm-hmm. So I think betadine, alcohol swabs, doxycycline.
Just a quick question for you, Dr. Dodge. You mentioned doxycycline, a recognized antibiotic. Would azithromycin also be appropriate, or would that be too? Azithromycin, Zithromax.
Azithromycin. Yeah, that's a little more expensive antibiotic. It's a good antibiotic, but it's a 5-day antibiotic. It's more likely to cause some side effects than the doxycycline is. I think doxycycline is a better all-around one to use.
Right.
Azithromycin is a possibility, though. Yes.
Okay. And you also mentioned the swabs. Sorry, what was the name of those swabs again? Betadine, betadine, betadine. Betadine swabs, and of course, alcohol, clean instruments to use with patients, right? Things like that.
Yeah.
Okay. All right. Very good. All right. Well, anything else that would come to mind that should be in a shelter's medical supply cabinet? So we covered antibiotics. We've covered disinfectants. I know a lot of these cabinets already have iodine in it.
Yeah, some iodine to sterilize the water. That has to be used very, according to directions, very carefully. Mm-hmm. So that's a good thing to add. Yes.
Great. Okay.
And then plenty of I said rolls of bandages.
Right. Well, sure. Yeah. Yeah, because a lot of the injuries I would imagine would be people being hit by falling rubble, from destroyed buildings, things like that, and
exactly.
Burns, basic burns from munitions, things like that. But food poisoning, and not having access to clean water. I think that, in my opinion, looking at the information we have now, that has a huge potential to be one of the biggest problems for the health of the civilian population right now. Not necessarily bombs and bullets, but waterborne diseases and lack of sanitation.
Lack of sanitation, lack of adequate water. Period. That's huge.
Yeah.
And no kit can make up for lack of having enough water.
Yeah, that's true. That's a good point. So at some point there needs to be restored access to facilities and infrastructure, because I guess what we're talking about now is just a stopgap measure at the end.